proposal or plan to tie up with a government agency po with your program?
I think yun nga yung sabi ni Paul. One is with PhilHealth, if there are ways to work jointly in primary care. And pangalawa, we're always in close, of course, discussions with the Department of Health and also the Food and Drug, the FDA, for possible ways we can help. I'm sure there are many opportunities for collaboration with the government. Isa pa pala yung, even in the clinics, always close partnership with the LGU and what do you call it, the local health unit. Kasi importante yun. In many cases, maglalagay kami ng clinic, may ibang lugar walang barangay health center. May ibang lugar may barangay health center pero parang hindi sapat. So we have to work closely with the barangay health center. So hindi kami nagtatalo. So we're working together rather than against each other.
Just to add, we work closely with the Barangay Health Center. So every time we open a family doc clinic, before we open, actually, we get to meet with the Barangay Health Centers, trying to ask them how can we support the community, how can we help. Secondly, when we open the clinic, all of our patients, the first patients are all the Barangay Health Centers, for them to experience how a family doc would operate and the type of care that we actually give. And number three, our medical director is also working with the city health officers to come up with projects within the community. So, for example, in Parañaque, we're now looking at being accredited by the Parañaque City Hall as one of their healthcare providers for your medical certificates and so on, pre-work employment. And soon, we hope to also work with other city health officers.
We're actually we're very thankful. All the LGUs we've worked with so far, we're very thankful because all the mayors and local executives are all very, how should I say, forward thinking. So yung pag-iisip nila about healthcare and what to give to their constituents is very progressive. So whether it was in Parañaque, where we were very enthused with Mayor Olivares, for instance, and his own vision for healthcare, whether it's in Imus, Las Piñas, and the other places we've been to. Lahat. I mean, healthcare is a service that we need to give to all our fellow Filipinos. And so it's really an easy partnership once everyone is together working for a common cause.
Hi, good morning po. For Sir Paulo, what are the biggest challenges so far that AC Health have encountered?
Magandang tanong po yun. And that's why I guess I ended with my statement to encourage both healthcare practitioners and entrepreneurs. I guess one of the things that we always think about, or at least I wouldn't say it's an issue, but certainly a challenge, is the hiring of medical staff. No? And whether it's pharmacists or whether it's doctors or nurses, you need people, of course, medically trained, but may puso and wanting to really do this. Iba kasi it's a real community service to it. Kailangan magaling magserbisyo, kailangan magaling sa komunidad. No? And you know, the truth is we don't have enough practitioners. We don't have enough graduates coming out of the system. But kunyari in drugstores, they say, you know, every drugstore needs to have one pharmacist. But if you look at the numbers, there are more drugstores than there are licensed pharmacists in the Philippines. So hindi sapat yung number of pharmacists na ginagraduate natin as a country. So we need more. And I think same with doctors, same with nurses and rad techs. And it's really an encourage, if I could, would encourage our medical practitioners, especially our medical students, when they think about careers in the healthcare industry, that there are more opportunities now than just the traditional opportunities na nung lumalaki tayo. Today, you can be part of Generica, you can be part of MedGrocer, you can be part of Family Doc, Qualimed, Puntuta MD, and be part of a growing family that serves the community.
It was mentioned a while ago that you are looking to partner with finance and health tech companies. So, are there any companies already in mind?
Yes, we're actively exploring partnership opportunities with a couple of both financing institutions and technology providers.
Hi, sir. Follow-up question. So regarding technology, it was already mentioned that AC Health already has the EMR. So what other technological innovations is there in the plans? Are there in the plans?
There's quite a few. One is the electronic medical records that we have right now is mainly for clinic at the clinic level. So it's what we call a clinical information system. You can have many variants of EMRs for hospitals, for other facilities as well. And so that's something that we're working on, number one. Number two, yung EMR is just a record. What's actually more important for us is what to do with those records in terms of epidemiological studies, population health analysis. Then you can really do community health. So if you know, for instance, what the prevalence is of diabetes in Sun Valley, Parañaque, then you can do proper outreach in the community, proper educational training in the community, and other intervention types that help the barangays and the villages, na hindi lang one person at a time. So investing in analytics is one thing that we're doing. And then the third, I think there's a lot more to do, and Jerome and I have been talking about this in terms of putting more services on your phone. So telehealth is Consulta MD, that's one thing, and Grocer is another. But we have a dream that anything you need, you can get on your phone as it relates to healthcare. Gusto mo makita yung dati mong lab results? Tinan mo sa telepono mo. Gusto mo mag-order ng gamot? Tinan mo sa telepono mo. Gusto mo tingnan kung ano yung dati mong prescription? Tinan mo sa telepono mo. You want to call a doctor? You want to set an appointment? You want to go to a pedia for your kids? Or any other specialist? Nasa telepono mo. So that's the dream. Easier said than done, but something that we're also working on, an integrated healthcare solution that's on your phone. Jake.
Yeah, well, just to add to what Paolo said, we're also looking at something na ila-launch hopefully very soon that will allow anyone, anybody, access to a pharmacist no matter where you are. And then even expanding it further, maybe even up to doctors or whatever. It also addresses the current shortage of pharmacists that we have. It's basically what we would call our virtual pharmacists. So it allows you to talk to a pharmacist face to face or by chat or by voice call at any time of the day, preferably during working hours when we launch muna. No, but any time of the day to address any needs you might have. No? Because I think, like Paul mentioned kanina, that's the main problem is access to the medical practitioners. Especially when you go out of the city. It really becomes a problem. And we in Generica is working on something which we hope to be able to launch soon, very soon. Of course, our biggest challenge lang is also something that the government is also trying to address, which is access to stronger internet network across the Philippines. Kasi it's easy to go outside, pero technology becomes useless kung wala pong mga internet connections. No? So hopefully we'll be able to do that, and with the help of the government also become a better service para even if hindi ka na makatayo, hindi ka na makaalis ng bahay mo, may chance pa rin na may makausap ka na doktor para at least medyo mas mapangalagaan nga yung health mo moving forward.
For family doc, ano ko lang po medyo anuhan lang natin. Gusto ko lang talagang medyo malaman yung sa family doctor yan. Talagang tinutuwan ko. So you're open Mondays to Saturdays, you're open 9 what's this, 9 to,
7
7 to 9, there's always a doctor.
8 o'clock, 8 a.m.
8 a.m. ang doctor.
Yes.
Tapos you have diagnostic po. Besides dito sa nakita ko that you have x-rays and CBC, ano pa po yung bago? Like especially, sabihin natin for, recently kasi medyo naging concern ako sa mga line-in clinics. Kasi medyo namatay yung baby ng friend ko. How parang gaano na ka-aggressive when it comes to those lines yung family doc?
Yes.
Tapos ano pa yung pinakabagong equipment po na meron na kayo ngayon?
So thank you very much for because very timely because we're gonna launch our OB Solo OB Solo services.
Ayun.
So bago pa lang pinapanganak, makakapunta ka na sa family doc for ultrasound. So we partnered with the GE and we have actually one of the I would say best ultrasound available that can do actually not only OB Sono but including 2D echo. So we will be launching soon and in our clinics, but not all clinics do have ultrasound. But what we did was to actually create a cluster. So within a 2 kilometer, there's usually a clinic that has X-ray and ultrasound to make it convenient. Now, in line with the question, yung OB Sono, so which means usually a health center or a line-in, when you go there, the first thing they'll ask is an ultrasound. So what we meant, and in the communities that we are at, usually, babiyahe pa yung pregnant woman to get it from a hospital or sometimes very expensive for a specialty center, for example. So we will launch that and we will have that available also. So and it will be very fast because within 30 minutes you can already get your image as soon as you have that. In Family Doc, we actually accept from infant up to senior. So wala tayong pinipili sa Family Doc because we're basically family medicine, we're primary care. So our doctors can actually see various patients. Usually, even when we started to open, ang daming pedia. So we also made sure that it becomes affordable. So every Saturday, we also have Kiddie Day. So discounted ang prices doon, 50% off. And if you become a member ng Kiddie that's from up to 12 years old, you can avail also of discounts and may mga freebies din tayo binibigay every Saturday. We'll also be launching our 2D echo soon in line with the ultrasound. Basically, our intention is to open more clinics. No? Kasi doon pa lang sa pinaka-basic na need, ang paniwala ng family doc, when you go to primary care, usually maagapan namin mas maaga, mas gagaling ka, at less ang gastos. Yun ang gusto natin mangyari when we start to open more. And soon, we're still in development of more services. Yun nga, as what Sir Paul said kanina, napaka-importante yung analytics. Because that's where we will try to see what other services, what are technologies that we can put in sa family doc when we start to see what are the main issues in terms of primary care in a particular community.
Palap, sorry. Kasi diba, ang mga tao ngayon, the reason they go to clinics and centers kasi walang bayad. Or, diba, so how affordable, as affordable is family doc? Kasi diba, yun yung isa yung medyo nagiging reason why they opt to go to clinics, lying-ins, because they are afraid dun sa mga gastos.
Yeah, that's true, no? So talagang sabi nga nila, mahal magkasakit. And basically in family doc, when you go for a check-up, you become actually an automatic member. So the first is 400 pesos to become a member. And then once you're a member, our rates is 350 in the morning and 300 in the afternoon. So discounted ang afternoon rate natin. So non-peak kasi medyo mas konti yung mga tao doon, mas binabaan namin ang renta. But what we did to make it really affordable is that for the next, every time we open a clinic, we actually give a discounted rate for people to try. Kasi every time we open, since we're a new brand, hindi kilala. And we make sure that our clinics are really nice, well-scented, air-conditioned. No? Sabi nga nila, parang akala ng iba, parang nasa abroad daw yung feel. Ng, but that's also a concern kasi baka naman, sabi namin, baka naman mga tao matatakot pumasok. So, in the clinics that we open, our price is only 200 peso for the consult. And then once you become a member, kasi automatically maging member ka na, you also get discounts for your labs and imaging. Currently, we also launched our 20% discount for 200 of the medicines, top medicines. Diniscount namin just to make it really affordable for people.
So hindi lang senior yung nakakakuha ng 20?
Hindi lang senior, even walk-in. Kahit hindi ka member, pumunta ka ng family. Kasi ang family doc, meron ka ng pharmacy. So, minsan, akala ng mga tao, pag clinic ka, makakabili ka lang sa pharmacy kung magpapacheck up ka. But actually, same with generic ka, pwede ka mag-walk-in. And you can avail of the 20% discount. In some clinics naman, pag naka-reach ka ng 500 peso in medicine, may libre konsulta. So we're really promoting primary care to encourage. Kasi the first thing that we actually encountered when we started to open our pilot branches, pag pumunta doon, ang unang tanong sa amin, may specialista ba kayo? Tapos pag sinabi mo na wala kaming specialista, lalabas na. Pero nung tinanong namin, ano ba yung sakit? Di ba, for example, nanay may dalang anak. Sabi niya, specialista kayo, so usually hanap pedia. Tapos nung tinanong namin, ano yung sakit? Sumasakit ang tiyan. Eh, pwede yan sa amin. You don't have to pay a specialist of 600, 800, or even 1,000 peso. Sa family doc, matitingnan natin yan. So that's how we make it affordable and accessible.
Sorry, ang dami yan eh. For Sir Medgrow, Sir, yung sinusupply niyo pong gamot, di ba kayo po yung nagde-deliver? They call you, they say what medicine they need. So where do you get the supplies?
Salamat po sa tanong. Salamat po sa tanong. All our medicines for FDA certified. So we get from the manufacturers themselves, the biggest names, the biggest distributors po. Pero the guarantee po is everything is FDA certified. And in fact, many of our meds actually also come from generic.
Yun, sapat. So with the tie-up.
Apo.
Okay.
Actually, ma'am, just on your question also, I wanted to emphasize that sa family doc, pwede kang mag-walk-in as a member, but we're also partnering with many of the institutions around the clinic. So kunyari small business owner ka, or eskwela ka, or planta ka na may mga empleyado, we're working closely with them para we can find ways where they can offer to their employees what we call family cards.
Okay.
So mga empleyado naman yon, and I'll let Paul explain the mechanics of that.
So most of the SMEs cannot afford actually HMO for their employees. Diba? Yun talagang problema. Pag maliit na kumpanya, usually ang health benefit mababa. Usually either PhilHealth, SSS, the basic lang. So what we feel is that we can actually provide SMEs with an affordable package for their employees. So for example, as what Paul mentioned, we have a family health card, Family Plus card, which actually for less than 1,900, 2,099 per employee, you can actually have unlimited consult for 3 dependents. And wala tong wala, hindi gaya ng HMO na bawal pag 18 years old above, bawal pag senior, pag 65 years old. So for an employer, madali kasi we also entertain installment payment. So they don't have to give the 2,999 outright, but they can actually pay in installment and they can cover their employees. And there's no minimum, pwede 5, but I think our first was even a home service massage. And now we're a partner with a bus station, having 200 of their employees enrolled also. So napaka-convenient kasi nandun lang sa community, malapit sa kanila. It covers dependents and no limitation in terms of age. And third, it's unlimited konsulta. So once may card ka na 2,999, you go to the clinic, 2,099. Then you go to the clinic anytime libre yung konsulta ko.
So wala tayong age bracket dito.
Wala rin age bracket.
Since sabi mo sir, medyo ano talaga, no? Sorry naman.
Parang kailangan pumunta niya sa clinic.
Oo nga, parang mag-uusap na lang kami ni Ma'am mamaya. Oo, usap tayo mamaya, Ma'am.
Any more questions? Okay, with that, thank you very much for